Friends, welcome to Pediatrics by Dr. Saman Fatima. So today we are going to learn 3 high yielding points from the topic of nutrition. So first of all, we are going to read a few points about Kwashiorkar. Kwashiorkar. So Kwashiorkar is a type of protein energy malnutrition where edema is prominent. Right? So there is a triad. What is the triad of Kwashiorkar? Please remember this mnemonic. GEM. You can remember this with the help of this beautiful mnemonic GEM, GEM. G for growth retardation. Here G for growth retardation. E for edema and mental changes. So mental changes are quite profound in Kwashiorkar. Right? So GEM, growth retardation, edema and mental changes is the classical triad of Kwashiorkar. And what is the staging of, if we talk about staging of Kwashiorkar, so staging is based on edema because edema is the main feature. It is based on edema. So there is grade 1, grade 2, then grade 3 and grade 4. So there are 4 grades of edema. So edema first appears on legs. So pedal edema, in grade 1 you see pedal edema, and in grade 2 facial edema is present. So along with pedal edema, edema is also present over face in grade 2, so facial edema. In grade 3, edema is also present in chest and paraspinal space. Chest and paraspinal edema is also present, right? In grade 4, ascites is present. Grade 4, ascites is present. So this is the grading of Kwashiorkar, grading of edema in Kwashiorkar. In grade 1, edema first appears on legs, then on face, then on chest and paraspinal space, and finally ascites develops. So you can remember this with the help of a hypothetical diagram. It will be easier for you. So in grade 1, pedal edema is present. This is grade 1. Then later facial edema is present. Then grade 3, chest and paraspinal edema is present, and finally ascites is present. So pedal edema is grade 1, facial is grade 2, then chest and paraspinal grade 3, and fourth is ascites. So this way it is easier to remember. Now let's quickly talk about marasmus. Few points about marasmus. So marasmus is mainly known for muscle wasting, muscle and fat wasting. So here also classification also based on the grading, also based on wasting of fat, right? Wasting of fat. So wasting of fat. So there are 4 grades: grade 1, grade 2, grade 3 and grade 4. What do you see in this? So grade 1, the loss of fat occurs in axilla and groin. Loss of fat from axilla and groin. So in grade 1, the loss of fat occurs from axilla and groin. In grade 2, the muscle is lost from thighs and buttocks. Thighs and buttocks. Grade 2, the fat loss occurs from thighs and buttocks. That is why here you can see baggy pant appearance, right? Baggy pant appearance because wasting of fat and muscle occur from thighs and buttocks. And then in grade 3, chest and abdomen is involved. The fat from chest and abdomen is gone. And lastly, the fat is gone from face, that is buccal pad of fat. Buccal pad of fat is last to go. Again, you can remember this with the help of a diagram. It will be easier for you. So axilla and groin are first to involve, then from thighs and buttocks, then chest and abdomen, and finally from face. So when the buccal pad of fat is lost, it is known as old man appearance because of loss of buccal fat, the child looks like old man. So it is old man appearance, right? So this is axilla and groin is grade 1, then thighs and buttocks is grade 2, then chest and abdomen grade 3, and finally grade 4 is face. Now we are quickly we are going to learn about one more staging, or you can say classification, whatever you want to call it by name, doesn't matter. So we are going to talk about deficiency of vitamin A. So the entire syndrome, all the effect of vitamin A are together known as xerophthalmia. Xerophthalmia. So let's read about it. First point number 1, what is the earliest symptom of vitamin A deficiency? So what is if we talk about vitamin A deficiency, so what is earliest symptom and what is earliest sign? So these two both are separate questions. What is the earliest symptom and earliest sign? So the earliest symptom of vitamin A deficiency is night blindness. Please remember, the earliest symptom of vitamin A deficiency is night blindness, whereas the earliest sign is xerophthalmia. Xerophthalmia, or if you want to specify, it is conjunctival xerosis. Or dryness over conjunctiva. Dryness over conjunctiva or conjunctival xerosis is the earliest sign. Okay, so in xerophthalmia there are some primary signs. Let's take this to the another page. So there are some primary signs and there are some secondary signs. Please pay attention. So X is for xerophthalmia. X1, then X2 and X3, right? Here it is XN, XF and XS. So primary signs X1, X2 and X3. X1 is divided into part A and B, part A and part B. X2 is single. X3 again is divided into X3A and X3B. So what are these? X1 is conjunctival xerosis. Remember, just now we read that the earliest sign of vitamin A deficiency is conjunctival xerosis. So this one is the first to appear, conjunctival xerosis. Then X1B is bitot spots. So please remember that bitot spots also occur inside conjunctiva. So in X1 basically conjunctiva is involved, and conjunctiva is getting involved. Whereas in X2 corneal xerosis is present. Corneal xerosis or corneal dryness is present in X2, right? In X3 it is a more severe form, so corneal ulceration is present. So in X3 corneal ulceration is present. Please remember, in X1 only conjunctiva is getting involved. X1A is conjunctival xerosis, X1B is bitot spot. That too occur inside conjunctiva only. X2 is corneal xerosis, where dryness of cornea is there. Whereas in X3 corneal ulceration is there. This is more severe form, so corneal ulceration is present. So if it is involving less than 1/3 of the cornea, it is classified under X3A. Whereas corneal ulceration involving more than 1/3 of cornea, then it is X3B. Right, so these are the primary signs. X1A is conjunctival xerosis. Please learn this by heart. This is very important for every single prof, every single viva-voce exam, and even for NEET-PG exam. Multiple questions every year. Question has been asked from this topic, right? So X1A is conjunctival xerosis. X1B is bitot spot. X2 is corneal xerosis. X3A is corneal ulceration involving less than 1/3 of cornea, and X3B is corneal ulceration involving more than 1/3 of cornea. What are the secondary signs? Secondary signs, XN is night blindness, yeah, nyctalopia, night blindness. XF when the fundus is involved, so fundal changes, right? Fundal changes. XS is corneal scarring. So this is extreme form, non-reversible form, where corneal scarring is present. Corneal scarring. So XN, XF and XS. XN is night blindness, XF is fundal changes, and XS is corneal scarring. S for scarring, right? Please remember which segment of the eye get involved first in vitamin A deficiency. It is posterior segment, because night blindness, the earliest symptom is night blindness. Conjunctiva, earliest sign is conjunctiva, but it is getting involved after the the posterior segment, the retina, where due to defective dark adaptation, the night blindness is occurring in the patient. So please remember this point. So let's quickly learn about treatment also. Treatment part. What is the treatment of vitamin A deficiency? So vitamin A deficiency is an emergency. So if any child with symptoms of xerophthalmia comes to you, you immediately give him vitamin A in high doses. So what are the doses? If the child is less than 6 months, you give 50,000 IU. You give 50,000 IU. If the child is between 6 months to 1 year, then you give 1 lakh IU, 1 lakh international unit. And if the child is more than 1 year of age, then you give 2 lakh international unit. So this can be as in ml also. So in government supply, the vitamin A syrup, vitamin A is present in syrup form. So concentration is 1 lakh IU per ml. 1 lakh IU per ml. Please remember this point, 1 lakh IU per ml. Understood? And how many doses you have to give? If they ask about doses, so first dose if you have given today, so this is day 0, then repeat on next day, that is day 1, and then the third dose has to be repeated after 4 weeks. Third dose has to be repeated after 4 weeks. I hope this lecture is useful.